Hi, in today's video, I'm going to talk you about how exercise affect your blood pressure, help you to find more natural treatments to lower your blood pressure. As you can see, exercise can increase blood pressure, but the effects are typically temporary. Your blood pressure should gradually return to normal after you finish exercising. The quicker your blood pressure returns to its resting level, the healthier you probably are. According to guidelines provided by the Centers for Disease Control and Prevention Trusted source, normal blood pressure is less than 120/80ths of a millimeter Hg. This includes a systolic pressure reading under 120 mm Hg, and a diastolic pressure reading under 80 mm Hg. However, exercise increases systolic blood pressure. Systolic blood pressure is a measure of blood vessel pressure when your heart beats. In fact, diastolic blood pressure is a measure of the pressure in the blood vessels between heartbeats. It shouldn't change significantly during exercise. If it does, consult your doctor. It's difficult to say conclusively what blood pressure readings are considered healthy after exercise, as blood pressure varies from person to person. Normal levels for one person might be a sign of a problem for another person. In general, though, high blood pressure after a resting period of up to 2 hours following exercise includes any reading greater than 140/90ths of a millimeter Hg. Low blood pressure after exercise includes any reading lower than 90/60ths of a millimeter Hg. Aerobic activities such as swimming, cycling, and running put additional demands on your cardiovascular system. Your muscles need more oxygen than they do when you're at rest, so you have to breathe more quickly. Likewise, your heart starts to pump harder and faster to circulate blood to deliver oxygen to your muscles. As a result, systolic blood pressure rises. It's normal for systolic blood pressure to rise to between 160 and 220 mm Hg during exercise. Unless you've cleared it with your doctor, stop exercising if your systolic blood pressure surpasses 200 mm Hg. Beyond 220 mm Hg, your risk of a heart problem increases. Different factors can influence how your cardiovascular system responds to exercise. Some of these factors include diet, medical conditions, and medications. For instance, exercise hypertension is a condition that causes an extreme spike in blood pressure during physical activity. People with exercise hypertension can experience spikes in systolic blood pressure up to 250 mm Hg during exercise. In general, your blood pressure should return to normal within several hours of a workout. Even then, you might notice that your blood pressure doesn't return to exactly what it was before exercise. That's because it's normal for blood pressure to drop slightly within a few hours of exercise. It's safe to exercise if you're at risk for high blood pressure or with high blood pressure. In fact, regular exercise can help you keep your blood pressure in check. Significant drops in blood pressure after exercise are a risk factor for developing or having hypertension and having certain types of heart disease. While most people experience a slight drop in blood pressure following exercise, that people with hypertension experience more significant decreases in blood pressure. Well, it's normal for blood pressure to rise during exercise. However, extreme spikes or drops in blood pressure can be a sign of a medical condition, such as being at risk for or having hypertension. As you can see, it's usually safe to exercise even if you have low or high blood pressure. In fact, exercise can help you keep your blood pressure in check. Speak to your doctor with your questions about exercise and blood pressure. That's the end of this video. Thanks for watching, and don't forget to click link in description below to discover more about the easy ways to lower your blood pressure and reverse it quickly.